Welcome to HFMA's 2025 Annual Conference in Denver. I'm excited to be here today with Aaron Scheimoff from athenahealth. Aaron, please introduce yourself.
Well, thanks for having me. My name's Aaron Scheimoff, and I lead athenahealth's product strategy for our revenue cycle services.
Wonderful. Well, I'm excited to be here today with you to get some insights from you on what's happening from your and athenahealth's perspective.
Sure.
The first question is really around this healthcare landscape. As we think about it continuing to evolve, the trends that are happening, what's emerging, what do you see shaping the future of revenue cycle management, and how is athenahealth positioning itself to adapt to all of these changes?
I think that's a good question, and forgive me if the answer sounds a little bit obvious. If I say the words AI and automation as the first words out of my mouth in every single conversation I'm having over the next couple of days, it would make a lot of sense. Those are the trends that are really starting to dramatically affect the RCM landscape. And at athenahealth, we've been working in AI for the better part of 10 years. But the recent generative AI capabilities have really accelerated our ability to integrate AI into all areas of product delivery and product and service delivery. So it's showing up everywhere. And it's very exciting for us because we're able to do things that we weren't able to do before. And it's not just, hey, are you analyzing your denials better, which of course you can, but it's showing up across the continuum of RCM. So it's showing up in prior authorization, in credentialing, in claim rules, and in editing. Of course, the data and insights that are associated with AI is what makes it sort of really interesting and really powerful. So not only can you accelerate workflows, but you can get better outcomes because you've got better data associated with it.
Thank you, Aaron. You know, I think we hear a lot about AI and automation right now, and a lot of folks are adopting it and focusing on it. Another major change in the healthcare industry is the shift towards value-based care. Yep. So thinking about that, what are the implications you foresee for hospitals and healthcare systems? How can a CFO leverage these trends in this space? And how does athenahealth support those CFOs in those health systems?
If you want to be successful as a CFO in VBC, you're going to need to make sure that you're going to get paid, which means that you're going to need to look at the continuum of care across all care locations. And it's not just about the care that's occurring within the walls that you can control. And in order to do that, you're going to need to make sure that you have a good platform strategy and a good data strategy. And at athenahealth, we have an excellent platform strategy. We've spent 25 years building out connectivity to all sorts of different places where your clinical data could be stored, whether it's HIEs, hospital systems, pharmacies, state registries, the list goes on. But there are thousands and thousands of connectivity points that Athena maintains that come right out of the box, so that when you're on Athena's network, you can get access to the data, because it's about having the right patient data in the right place at the right time. So athenahealth can help you get the right patient data, in the right clinical data, into your chart, but then it has to be accessible. And so it's not just good enough to have data dropped into a location, because more data would equal more problems unless you could make sense of it. So one of the beautiful elements of how Athena works with data and integrating data for interoperability purposes is it gives the practice and the health system the ability to figure out which is the most important data and to put it into the chart in the right space. So that now that you have the right patient information, you've got it into the right spot, and now it's going to be actionable via workflows for the provider. Without those three components, you won't have a good value-based care story, and if you're a CFO, your finances are going to suffer.
Great, thank you, Aaron.
You're welcome.
I'd like to thank Aaron and athenahealth for their time today and their support and their insights. So thank you, Aaron, for this
It's a pleasure
time.
being here. Thank you.